While we're all born with a certain genetic makeup, much of our health is really about the choices we make. We make choices as individuals, we make choices as agencies, organizations, and as communities, and these choices make a difference in our health and our lives. If you think about us as individuals, we make choices every day that affects our health and the health of those around us. For example, we opt to avoid using tobacco products because secondhand smoke has been proven to have ill health effects. It affects those around us, it affects our children. Choosing healthier food options is another daily choice. It may seem that the food choices available aren't always the healthiest. Many of us are fortunate to have locally grown produce available at farmers markets. Although fresh is nice, there are some healthy choices in the frozen and canned sections as well. Finding time in our day to include physical activity is sometimes one of the most difficult choices. However, studies have shown that just 30 minutes a day, or about 150 minutes a week, can make a difference in our health status. Many of our communities have built exercise facilities. They have walking and bicycle trails to help us get the physical activity we need. Agencies and businesses also make decisions which impact our health, whether it be a smoke-free facility or a wellness program for their employees, and small incentives and wellness programs can have a significant impact on the health of a population. Communities can also choose to make decisions to impact their citizens. This is what the Community Health Improvement Plan is all about. Everyone's been invited to help make decisions about the direction their community wants to take for the health of its citizens. One strategic initiative, which is tobacco and substance abuse, was an initiative that's been chosen among many of the communities in the Green River District, and we've made significant strides in changing policies and setting ordinances since we began our Community Health Improvement Plan in 2012. Access to care is yet another initiative for improving the health of our communities. Providing our citizens access to providers or improved transportation, it might be dental and mental health services, all of these can significantly improve the health of an area, and the Affordable Care Act helped increase access to these services. Another important example is obesity. Obesity is the #1 most chosen initiative across the Green River District. If we impact obesity rates in children today, we're making an investment in health outcomes of tomorrow. We know that chronic disease rates parallel obesity rates, so any improvement in our obesity rates is likely to improve both. So now let's take a look at the impact our coalitions have made across the district area.
Healthy Horizons strategic initiatives are substance abuse, obesity, and access to care.
The Obesity Action Team group of Healthy Horizons is really focused on addressing health and nutrition issues in the Owensboro-Daviess County community, whether it's individuals, families, youth.
Our Better Bites campaign, we've gone from just learning about it to actually initiating and even attaining grants through the prior Pioneering Better Communities program. So we do have some grant money to put that program into concession stands in the area.
We did the launch on September 30th, which was a huge success. We were really pleased with that. We had great feedback. A lot of people in the community really interested in the program and want to see this be successful. Our goal right now is to really just bring awareness to the project, really get the logo out there, get people in the community familiar with it, so that maybe when the kids after school and at school they see a Better Bite sign or the logo and they recognize it, and then they're out at the pool or the ball field or somewhere else where there's a concession stand or snacks option, and they see it again and they remember that they liked that item and that it was healthier, and then they choose that healthier item again.
The substance abuse team has been very active and gotten a lot of grants that are specific for treatment, rehab. There's one particular one that'll be happening in the next probably 9 months, and it'll allow them to get a certain kind of medication that will help treatment.
Some community partners that have really been involved this year, the Owensboro Family YMCA, Boys and Girls Club, Daviess County and Owensboro Public Schools, Audubon Area Community Resources, the Child Care Aware Program, gosh, I hate to leave anybody out. You know, I mean, there's just a lot of partners. Owensboro Parks and Rec Department, County Parks and Rec Department. So we've had all of those people at our meetings throughout the year. Owensboro Regional Farmers Market. We have representatives from Owensboro Health and the health park as well. So really great key community partners that are really focused on the health of our community.
Hancock County Coalition kind of went dormant several years ago. So in 2015, we kind of picked that back up and started over again.
The three strategic initiatives that we identified in Hancock County were access to care is our #1, obesity, and tobacco use.
We've done several different projects. We've done our 100-mile club. We've done that for the last 2 years. We've had about 168 people sign up, and that is where we walk 100 miles from Memorial Day to Labor Day, and that takes a lot of commitment. And then at the end we have a celebration and give out some prizes that's donated and things.
Our second initiative that we did in 2015 was Health on Wheels. It was a community bike ride in the city of Lewisport. Near the end of 2015 we did receive some money from our local grad, and that helped us to pay the salary for our facilitator for our coalition. Now in 2016, we are applying for a grant that will allow us to have funds to do the activities. It will allow us to have funds to pay a facilitator. And so we're hoping that we're really going to get our ducks in a row to have additional activities to offer our community. The initiative that would make the biggest impact for Hancock County would be access to care. There are a lot of individuals here locally who do not have transportation, and there is no type of public transportation in Hancock County at this time. So that, to me, that would be the one that would have the biggest impact.
We have, for the second time, have the same three initiatives, and they're tobacco cessation, teen issues, and also diabetes/obesity.
Well, the Teen Issues group, we've been going for a couple of years now, and we really are focused on reducing bullying with kids in our community and other risk-taking behaviors. We identified through a survey a few years ago with our high school students that risk-taking behaviors, in particular drug and alcohol use, bullying, teen sexuality, those type of things are at the forefront of what we're concerned about for kids in our community, and it's what kids are concerned about as well.
The adverse childhood events will be the next big teenage initiative, and purposely making it broader even than just teenagers, going more into families and cross-generational.
Our primary mission is to empower teens in our community to be healthy, and we think by reducing the bullying, reducing the other teen risk-taking behaviors, that in doing that we are going to help our teens be able to be healthy and well-rounded in our communities. So that's really what we're looking at, empowering them to be healthy.
We will have measurable progress soon. First of all, the smoking cessation, they are research-driven as well as data-driven, and we've seen progress in terms of numbers.
We've done some really great things. One of the things that we did a few years ago, as a subcommittee, we presented to Henderson County Schools, to the Board of Education, and made some recommendations about what we should do in terms of bullying. We recommended an evidence-based program that we could use district-wide. So that's something that I'm pretty proud of that we did.
I think these people are incredible. They come early, they meet on their own, they come in here, they're proud of what they're doing. I don't know how I could ask for more than that. I'm just trying to hang on to the magic of it and watch it happen.
The strategic health initiatives identified in McLean County were to increase the collaboration of health service partners, and to reduce obesity and increase physical activity, and to work to reduce tobacco use, not only of tobacco but all products associated with tobacco.
Our accomplishments have been, we have obtained a grant from Owensboro Health for a walking track for our middle school, and that has been established and built.
that's certainly increased activity among the students there and the public as well going there to use that track. And Meyer Creek Park, which is a 256-acre complex here in the center of the county, is offering multiple opportunities for physical activity with trails, walking trails, riding trails, playground equipment, and just a good place to walk and exercise. McLean County was just awarded a grant from Investing in Kentucky's Future for the Foundation for a Healthy Kentucky, and we received word just here in the last week that we received some $87,000 in the phase 2 stage of that initiative, and we'll be working very soon with leadership in our county and the coalition and all those members to begin to put that plan of action in place to provide additional activities and events and facilities around our county that will work to enhance and meet the objectives of meeting the obesity and the tobacco issues. We want McLean County moving and getting healthier. We're not just spending dollars because we were given dollars. We're spending them to improve the health of this community.
In Hancock County, like other cities in our region, we identified the 3 main objectives of increasing access to care. We want to have strong initiatives to combat substance abuse, as well as reduce obesity and increase physical fitness.
I'm mostly based at the schools, and so I know what's going on in the schools more and how it affects our community. So the things that we are doing in the schools is we are encouraging more physical activity with our students by having small groups go to the Family Wellness Center, having those students take home that information to their parents to get the parents involved. And then we have lots of activities like the Longest Day of Play, where we work with the Ohio County Hospital and with the Family Wellness Center and lots of our groups in the community to get those kids out, get them with their parents, get physically active.
By reducing obesity, increasing physical fitness, that has an overall impact on so many areas of health. You reduce your high blood pressure, you reduce your heart disease, you reduce your diabetes.
Another activity that we focused on as a coalition is our local farmers market. We just decided as a coalition that we needed to address the issues of building stronger families and eating more fruits and vegetables, and then grew the idea of the children's farmers market.
We are a community that when there is a need, you make a phone call and you reach out a hand, and you have so many different partners, community organizations that will come around a table and think, we need to solve this and make this a better place to live for our citizens.
Our strategic initiatives this year are obesity, and we're going to work on nutrition and physical activity under that, and access to care and tobacco. Just as an example, with the community gardens, we started out at the schools and at the senior centers and several places in town, and then the churches jumped in to help distribute. The jail inmates have been working some of the gardens and using the produce. The schools jumped in with some projects there. The library used the community gardens for their summer feed and read. And the extension office did canning classes, so everybody just kind of jumped in and did their part.
Union County Schools was fortunate to receive a School Garden Coalition grant, and the grant helps us to be able to put in place school gardens. And those school gardens are going to be used to supplement the food we serve in our cafeterias. The overall focus of the grant was to reduce student obesity and particularly look at BMI in students.
We've received several grants to help us. We've gotten several grants from the Union County ASAP group to put on educational events. We've gotten a community collaboration for children grant to do an event here about cybersecurity. United Way has given us grant money. We've recently gotten a grant from Owensboro Health to bring the community gardens into the school.
Obesity has been identified as one of our main concerns, and we feel like by starting with students and their education, we can have a bigger impact on the overall understanding of obesity and awareness.
If we just had a year to work on something, I think the thing that would make the biggest impact is the obesity and physical activity and nutrition initiative, because it affects so many other things. If you get that under control, it affects all the illnesses and the diseases and the chronic conditions that are plaguing our county.
So we're really excited. We think it's going to be a great move for us to be able to have this available and to help out our students.
You're out in public and you see people out and running and walking, and the 5K events are happening more and more often, and the gardens are growing, and that's how we feel like we're making progress.
The strategic initiatives in Webster County are obesity, drugs, teen pregnancy, and smoking.
Webster County Youth Council is a coalition of students who are dedicated to being drug, alcohol, and tobacco free. Their focus is to work to change environmental strategies, change the culture in Webster County, and to influence younger students to make the decision, the choice to be drug, alcohol, and tobacco free.
We have done lunch and learns concerning all of these needs in Webster County. We have done, had professionals come in and talk on all the harms and all the problems that are related to all of these strategic initiatives. And we have done them over several years, and hopefully that they are making a difference with each one, that we find new ways to present them.
Many years ago, the Youth Council started working to make our school district tobacco free. Our schools inside the buildings have been tobacco free for many years, but they wanted to make our entire grounds tobacco free, and in doing that, they have worked to educate not only school administrators and students, but also the community.
We want to continue our goals, but with I think in repetitiveness, we need to find different ways that we can make an impact, not only with our children, but with our parents, to get their attention that with all of our goals, there is a need for parents to be involved. They're involved in sports and things, but we need them to be involved in our health concerns for our children.